Welcome to our channel. Today we're breaking down the different modes of ventilators in a simple and easy to understand way. Now, you might be thinking, ventilators, that sounds pretty intense. And you're right, they are a critical tool in healthcare, especially for patients who need help breathing. But don't worry, we're going to demystify these machines and the different ways they can be used to help patients. Whether you're a curious mind wanting to learn more about medical technology or someone who wants to be prepared for any situation, this video's for you. Let's dive in. First up, we have CMV, or continuous mandatory ventilation. Imagine this. The ventilator is like a dedicated respiratory therapist that never takes a break. It delivers a set number of breaths per minute, making sure the patient gets a specific amount of air with each breath. Think of it like a machine completely taking over the breathing process for patients who can't do it on their own. This mode is often used in critical care settings like the ICU for patients who are really sick and need that extra support to keep their lungs working. It's crucial to monitor patients closely on CMV to make sure they're getting the right amount of support and that their lungs are responding well. It's all about finding that perfect balance to help them recover. Now let's talk about ACV, or assist control ventilation. This mode is like CMV's slightly more flexible cousin. It still provides a set number of breaths per minute, but here's the difference. It also lends a helping hand if the patient tries to breathe on their own. Imagine a patient who's starting to regain some strength and tries to take a breath. In ACV mode, the ventilator senses this effort and gives a little boost, making that breath easier. It's like having a personal breathing coach, cheering you on and providing assistance when you need it most. This mode is great for patients who are starting to recover and need a little less support than CMV. It encourages them to participate in their breathing while still providing a safety net. Next up is SIMV, which stands for Synchronized Intermittent Mandatory Ventilation. This mode is all about teamwork. The ventilator and the patient work together to share the breathing workload. Here's how it works. The ventilator delivers a set number of breaths per minute, just like in CMV and ACV. But here's the key difference. Between those breaths, the patient is free to breathe on their own at their own pace and depth. Think of it like having a workout buddy who spots you during those heavy lifts but lets you do your own thing between sets. This mode is often used as a stepping stone to wean patients off the ventilator as they get stronger and more capable of breathing independently. Let's move on to PSV, or pressure support ventilation. This mode is like giving your lungs a little nudge in the right direction. Instead of controlling the number of breaths, PSV focuses on making each breath easier for the patient. Imagine you're trying to inflate a balloon. It takes a bit of effort at the beginning, right? That's where PSV comes in. With every breath the patient initiates, the ventilator provides a little boost of pressure, making it feel like someone is giving that balloon a little pre-inflation. This mode is often used for patients who are breathing well on their own but still need a little help to overcome the resistance of their airways. It's like that extra push to get them over the hump. Now let's talk about CPAP, which stands for Continuous Positive Airway Pressure. Unlike the previous modes, CPAP doesn't deliver breaths. Instead, it acts like an air splint, keeping the airways open and preventing them from collapsing. Imagine you have a long, floppy garden hose. If you try to blow air through it, it might kink and collapse, making it hard to get any air through. CPAP is like putting a support structure around that hose, preventing it from collapsing and allowing air to flow freely. This mode is often used for patients with sleep apnea, a condition where their airways relax and close during sleep, disrupting their breathing. CPAP provides that constant pressure to keep those airways open all night long. Finally, we have BiPAP, or bi-level positive airway pressure. As the name suggests, this mode uses two different pressure settings, one for inhalation, IPAP, and a lower one for exhalation, EPAP. Think of it like having two different levels of assistance for your breathing. The higher IPAP makes it easier to breathe in, while the lower EPAP makes it easier to breathe out. It's like having a personalized air pressure system that adjusts to your needs. This mode is often used for patients with conditions like CPD or heart failure, where they need help with both inhalation and exhalation. It provides that extra support to keep their lungs functioning properly. So there you have it, a crash course on the different modes of ventilators. We covered a lot of ground today, from the full support of CMV to the gentle assistance of PSV and the airway opening power of CPAP. Remember, ventilators are incredible tools that help patients breathe when they need it most. Understanding the different modes can help you appreciate the complexity of respiratory care and the amazing work healthcare professionals do every day. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. See you next time.